Understanding a couple's fertility involves evaluating the entire couple, not just the male or the female partner. For men, that involves getting a semen analysis test. And that's what we're covering today on Lunchtime Live with the Center. Dr. Evelyn Neuber, who is the Center's Director of Research, is back to share about the semen analysis test, including what it is, how it works. Dr. Neuber, welcome back.
Thank you.
Well, let's start with the basics. What is semen?
All right. Yes. Basics is always a good place to start. So a semen analysis, semen is the analysis of the whole process, of the whole sample. So it's the entire ejaculate. So that includes the fluids that are secreted by the various ducts of the male reproductive system, the sperm itself, and any minerals and vitamins that are included in the semen that sort of help the sperm develop and grow. So it's an analysis of the entire ejaculate.
So can you talk about what a semen analysis is then?
Absolutely. So it's really one of the first tests that that men undergo when they come when they're seeking IVF treatment or any treatment with us. So it is an analysis of the entire ejaculate. So the first thing we look at is the color of the semen. So that I guess I should back up. Your doctor would give you a requisition for a semen analysis. So then you would come into the clinic. They do recommend that you wait between 2 to 5 days to produce a sample. We would provide you with a sterile container where you would produce the sample into. And then you bring the entire sample to us here at the clinic at CARS. And the first thing we do is we just look at the overall. So it's an overall view of the semen. So the first thing we look at is the color of it. So it needs to be a little bit whitish, clearish color. And that comes from the fluids that you would see. We would also look at the volume, how much there is. There's obviously no right or wrong for a semen analysis, but there's parameters that we say that are sort of within the normal range. So in terms of the volume, it's 1.5 milliliters. So we measure the volume of the sample.
Okay.
The other thing that we look at in terms of the semen part is liquefaction and viscosity. So those are two parameters that you want to make a note of when you're doing the semen analysis. And viscosity is how thick the semen is. So should be a little bit, has a thickness consistency to it. So we look at that, we analyze that. Is it increased viscosity, normal, or decreased viscosity? Decreased viscosity usually means that there is some of the fluids are missing. So it's not subpar is basically what we would call that. Then we also, liquefaction happens within about 15 minutes. So that's one of the reasons that you'll see in the requisition is that we would like you to have the sample here within the first hour, because initially it is sort of it's more of a congealed substance, and then it liquefies. And that the reason that happens is it allows the sperm to come out of the fluid so that it can swim up and fertilize the egg. So we make a note of that also.
Now you said bring it in. So patients are doing it at home?
Yep. Patients can produce samples at home or produce samples here at the center. We do recommend that you wait between 2 to 5 days before, after masturbation to produce the samples so that you have the maximum amount of sperm production.
Should they call our office to schedule it so that the timing works out, or how does that work?
Yes. Yep. You would get a requisition from your MD, and then you would call and schedule an appointment for a semen analysis. And we do them on Monday through Fridays here at the center.
Do we do anything in the office, or what if you live further away?
Yes, you could produce here. Yep, absolutely. We have private rooms where people can produce samples.
So what would you be looking for in terms of sperm? What is normal? What is
Right. Right. So yeah, so the second part of the semen analysis is the actual analysis of the sperm themselves. So they are part of the semen analysis. So a normal sperm has a rounded head. It's about 3 to 5 microns long and about 3 microns wide. In that head, there is both an acrosome, which is used for the sperm to penetrate into the egg, and also the DNA is located in the head. And then there's a mid-piece section, which has the mitochondria, which is the movement, which allows the sperm to progress forward, and then a tail, which propels it forward. So the first thing we look at is how many sperm overall does the sample contain. So we put them under the microscope and we count the sperm. We count both moving sperm and non-moving sperm. So that's a total concentration of sperm. Then we also separate the sperm into moving sperm and non-moving sperm. And the in-between category is what's called twitching. So they're alive, but they're not progressing forward. So you would get that also. So that's a percentage called percent modal. So the percentage of the total sperm that are moving and alive, basically, is what we're looking for there. Then the last test we do for the sperm is we make a slide of the sperm and we stain them. And that allows us to do the morphology of the sperm. So basically whether the sperm are normal or not. I think a really interesting fact about sperm is that 4% of if 4% of the sperm are normal, your sample is considered normal.
4%.
Yeah. So you stain it and then you look for any kind of defects. So like defects include if the head is larger or smaller than a normal sperm, if the tail is coiled, or if there's any kind of problems with the tail. Sometimes sperm have 2 tails. So those all count as not normal looking sperm. So that's morphology.
So if someone has an abnormal result under 4%, what does that mean for males and their ability to help a woman conceive?
Right. So the numbers are really based on initially they did studies of men who have children, and based on those samples, that's how they came up with what's considered normal. So I wouldn't say if somebody's under 4% that it's, you wouldn't say abnormal. It's just that they're not in that parameter and what has been determined as, based on men who have been able to, who've had children. So there's several factors that can lead to abnormality. There can be an infection. There can be a hormonal imbalance that's affecting sperm production. It can be a blockage that the sperm just don't come, the sperm don't come out. It can also be in a production. If you don't get the entire sample into the cup, you sometimes get a misread. So that's important to note also.
So so we work with women and men when they're coming to our office for fertility, infertility. We also see men out in the community who are not necessarily looking to build a family,
right,
in the form of, say, like a post vasectomy. Or so how is this test used for a post vasectomy check?
Right. Nope, that's the second really big category of the use of semen analysis, because you can't see sperm with the naked eye, so you need a microscope. So in a vasectomy, the goal is obviously not to see any sperm at all, or especially not moving sperm. So we do the same. We make a slide and we look for moving sperm at post vasectomy, and sometimes you have to do multiple semen analysis after vasectomy to really confirm that there is no moving sperm. So we look for that. So that is another reason that semen analysis is used.
So it may take a little time for the vasectomy, say, to heal, so that it is actually functioning in the way it's supposed to.
Yes.
Okay.
Yes.
Are there any other tidbits you want to share?
No, the other thing we we do with the semen analysis is it's used to get an overall picture. So I do think it's really an important tool to use. So additional tests that are done is the pH. We do the pH of the semen, and it should be above 7.2, which is definition of the normal sample. The other thing, since we're looking under the microscope, you can also see if there's high concentration of like white blood cells. And if there is a high concentration of white blood cells, that means that there is an infection. So that you'd want to treat that first and then come back for another semen analysis, so that you're getting a true read on the semen analysis. So it's wide. It's a very thorough test in that sense.
At what point, when it comes to infertility, do we refer to a urologist after a semen analysis?
Right. So I think if you have no sperm, that would be a good time to see a urologist. If you see no moving sperm in the ejaculate, you would look towards a urologist. Also, I would assume also with steroid use and drug use and all that you would want to go to your urologist to try to figure out how to solve that, as in terms of the sperm quality.
Got it. All right, Dr. Neuber, thank you for being here today. Thank you. You've been here before, so thank you for coming back.
Thank you.
And we'll see you next time on Lunchtime Live. And if you have any other questions, or if there's any, if you'd like to see how we can further support you, please check out our website at yukonfertility.com. Take care.
Bye.